So in some states and territories, the rules are slightly different, but in Queensland at the moment, access to hormonal contraception is through a prescription from a medical prescriber.
Now, how significant is it that from July, women in Queensland will be able to access a range of contraceptives, including the pill, straight away through their local pharmacist?
Yeah, well, that's right. This is a groundbreaking initiative, and it is wonderful for access to a greater health outcomes for our communities, especially rural and remote areas where sometimes it's very hard to see your local healthcare provider. So this pilot is going to leverage off the accessibility of your local community pharmacist, who is quite often open extended hours, late nights, weekends. It's really going to improve hormonal contraception accessibility for Queenslanders.
Now, as someone who has worked as a pharmacist in regional areas across the country, what kind of impact will this demand have on the pharmacists themselves?
Yeah, that's right. So the pharmacists will need to undergo an accredited training course to be able to qualify for the pilot. And it's really just pharmacists are very well placed to promote quality and safe use of medicines in the community. So pharmacists are very, very well placed to be able to participate in such a pilot.
Do you believe that the training will be vigorous enough? Because this is giving quite a bit more responsibility to pharmacists to take some of that pressure off GPs. Will they be well equipped enough to take all that on?
That's right. Well, it is an accredited training course, and the consultation to be able to supply the medication will be an intense consultation where the pharmacist will have to ascertain and follow the appropriate steps to ascertain whether the prescription is going to be safe and effective for the consumer.
Mm-hmm. You mentioned that it varies from state to state in terms of access to the contraceptive pill. Where does Queensland sit in that spectrum?
Yeah, that's right. So at the moment, yes, Queensland falls under the with women having to access the prescription through a medical practitioner.
Mm-hmm. And in future, do you see more states and territories taking up measures like this to make it more accessible to people outside of a GP's office?
Yeah, absolutely. So currently ACT and New South Wales have a version of this whereby pharmacists can continue supply of oral contraceptive medications. Where this pilot is going to be different will be that Queensland pharmacists, after undergone the training, will be able to initiate the therapy.
And what do you see the long-term benefits here of this being? As somebody who's worked in this sector and in rural areas in particular, how beneficial will this be to women in these areas?
Oh, remarkable. Access to contraception shouldn't be a luxury, but rather a basic healthcare need. So without question, it's going to do great things for access to hormonal contraception for Queensland women.
Mm-hmm. If we look at the global scale here, much of Asia, Africa, South America, the access to the pill doesn't require a prescription. Based on your experience in pharmaceuticals, do you see a time when Australia will join that list?
Look, I think that's why we do pilot programs like this, so that we can roll it out and see the benefits state by state. That's traditionally how our industries work so far. So, I mean, wouldn't it be great to think that one day we can get to that sort of level?
Mm-hmm. Queensland pharmacist Jacequeline Meyer, thank you for joining us.
Thank you.